Joining us on this broadcast is Mr. J Radhakrishnan, the Tamil Nadu Health Secretary. He's been at the forefront in the fight against coronavirus in the state. Mr. Radhakrishnan, thank you for joining us here on India Today. You know, as far as Tamil Nadu goes, the state has been doing a lot of things right, which is that you've ensured your testing rate is one of the highest in the country. You've had an excellent recovery rate. Fatality rate is also low. But what remains a worry is that every single day, the cases are continuing to rise at an alarming rate.
Good morning, Akshita. See, Tamil Nadu actually follows a classical pattern in which, the WHO experts or the Government of India public health experts and the experts who are attached to the state government advise. See, their advice has been that, we have to really do very aggressive testing, and Honorable Chief Minister has also said that, let us not limit the testing on any account. We have to, trace, test, and in fact, the testing has to be based on even intensive fever camps. In the last 10-15 days, we have done fever camps. It is not just severe acute respiratory infections and influenza-like infections, but also additionally, anybody with even a single symptom has to be traced. That's the only way. So we are not immediately really concerned. I cannot say that, we should not be worried about the numbers. Our concern has been to get the people early and get them treated, ensure that their contacts are also tested, and by that, address the fatality. Case fatality rate may be low, but the numbers wise also we are concerned that, we have to ensure that people, get treated effectively and don't die. Even this number should be brought down.
Mr. Radhakrishnan, there's been a lot of debate over the strategy with regards to Chennai and the lockdown that was imposed from June now till 5th July. Is the lockdown a bad idea? And is that really the solution? Ensuring there's lockdown after lockdown. Is that a bad, strategy at this point? Because there was also a medical expert who said you can't kill a mosquito with an axe. And that's what a lockdown strategy essentially is.
See, I think, you should take the entire interview in perspective. Let us understand that, before looking after the health department back recently, I was also coordinating from May the Chennai position. So what was happening in Chennai was 6 zones where repeatedly cases are coming, because in Chennai and certain select areas, there's a tendency of people not to get tested, fearing quarantine and spreading the disease. This lockdown was not a single effort just to look at lockdown per se as only lockdown. It was accompanied by rapid ramping up of fever camps and testing just adjacent to the place where people are there, so that, the stigma aspect is also, removed. And this lack of movement has ensured that, the doubling rate wise, we have really done well. And we have got a grip on the places where the cases were concentrated, and the complaints of people to come out for testing, get them isolated and treated has improved, which in fact was highly appreciated by the medical committee. Unfortunately, one comment has been, disproportionately quoted, but we are very effectively also focusing on containment. If you look at it, is select places, Chennai, select areas in and around Chennai, then Madurai. But in all other places, our focus has been very, very severe containment, not looking at street-wise plans, developing micro plans for areas, urban slum. We need a different strategy to a unique cluster arising out of somebody coming from outside. Every state has this challenge of people coming from outside, even people from Chennai going to another place. So that is a different strategy. So strategy has been worked, street-wise micro plans have been worked, area-wise micro plans, and streets have been clubbed together for looking at clusters and ensuring very effective. There's something called as smart lockdown, very effective. Cluster containment is also being followed.
But that will be the question then, Mr. Radhakrishnan. There are several parts of Chennai that have been identified as the worst affected. Is the strategy then shouldn't be that you lock down those areas and let the rest of the city function, and then perhaps open up things? Because you see in places like Delhi, despite the huge surge in cases, now they've ramped up testing. They're ensuring that things continue to function. How long will we keep a lockdown? My other follow-up question to that is also, when do you expect the effect of the lockdown to actually be seen with regards to the numbers and how you're faring really in the fight against the virus?
See, let me be very clear is that, as far as the lockdown and those issues are concerned, it's part of the Disaster Management Act, and there is a separate department looking into it. And again, I'm telling is that let us not jump jump the gun and say that, we are on eternal. It has given tremendous help in, ensuring that the COVID care centers are ramped up. Facilities. So has had its tremendous influential impact has been there. But definitely, if you look at, we are also looking at ensuring that it's not just focused on Chennai. In Chennai, the real challenge which I want to share with all of you, not in Chennai, I was hearing a expert from Geneva saying that vaccine may even take up to 2 years. At this stage, the compliance of methods, there has been a slackness in select areas where we have cases. Not that entire Chennai was having cases, but they were actually moving around and creating this problem. These days have helped in them because we have brought in 93 NGOs and almost 2,500 volunteers who are actually talking to local influencers and ensuring that this compliance of non-medical method is there. So it was a strategy mixed with increased and also focus on non-medical methods. I'm assuring you that, as a public health person dealing with the department, it is very unfair to predict the understanding of the way that the disease is spreading from individual to individual, that we have to follow SOP. This time we have gained in ensuring that people follow.
No, so then, Mr. Radhakrishnan, do you feel that Chennaites haven't really been doing their bit, that they've not been following norms, which is why you had to impose this lockdown?
Let us be very clear.
That let us not paint everybody as black and white. What was happening is 80 to 85% people were following, complying. But everywhere, even in the worst containment areas like Tatangram, or in Motilal Street, or this Raipuram area, there were 10 to 15% persons feeling that it is just another cough kind of thing, because a lot of asymptomatic cases are coming, and a lot of people not coming out to get tested, but spreading it internally. So to that extent, this was very effective in keeping. Earlier, we used to have people used to go, and there used to be 40 sample collecting centers. Now the camps are just adjacent to these containment areas. 100% we are checking up. Then buffer zone, we are ensuring that the camps are very nearby, and the sample testing is just across free sample testing. So the movement of people not being there in this period has ensured that before they are detected as positive and all, they don't spread it to others. So that way it has been very effective. We have to keep watching. Everybody has to join together. This change in behavioral change is the issue which we are really now focusing on. A lot of videos with public personnel, leaders, Honorable Chief Minister, appealing to people on the need to follow SOP, and also a little bit of penalties on people not following. We are doing it in a multimodal way. Plus, we have involved all departments, and especially the NGOs. They have also really been doing, helping and doing their bit.
So, Mr. Radhakrishnan, my final question to you. When do you see Chennai flattening the curve? What's your projection, speaking to experts?
See, very frankly, our at the cutting edge experts have been giving certain projections. They say, June X, there may be peak Y, but all experts are uniform that increased testing will lead to a surge for a few days or maybe 1 or 2 weeks. But that will ultimately ensure that we flatten. Already we are saying that, Chennai has been, if you look at net cases and if you look at discharges, we have been in a sort of, the incline has come down. Incline. So we are very closely monitoring. I won't predict, but the way things are going, I personally feel we will, if we follow the experts and we ensure that the non-medical methods parallelly help in changing the behavior, we should be able to really cross the hump, and we are keeping our fingers crossed. And I really am saluting the cutting edge conservancy and the sanitary workers and the doctors and the people who are actually spending their time in containment zones. Hats off to them, and also A lot of NGOs have joined together with government with full protection. They are also spreading these messages. I think we will be able to. We are on the right track according to experts. They are supporting that we are doing 100% RT-PCR testing, and every day 30. We are not going for rapid testing consciously because we may miss out on certain cases. We have ramped up testing. Honorable Chief Minister said, don't limit testing. Anybody walking in should be tested. Anybody joining. We are ramping up hospital infrastructure also. So that way also we are trying to keep pace with the cases.
All right. Mr. Radhakrishnan, all the best to you and the entire administration in Tamil Nadu in really fighting this coronavirus crisis. I must again reiterate, Tamil Nadu is one of those states that's focused very, very hard on testing. No matter what the numbers, they made it very clear they will continue to test and trace. Mr. Radhakrishnan, thank you for taking the time out and speaking to us here on India Today.